Hey everybody, I have another topic that I wanted to discuss today, and this one is about the shot, the Sublocade shot, which is a long-acting buprenorphine injection that you get once a month. And it's been just over a year since we started using it here. It was approved by the FDA just a few months before that last year. And so the idea is that for people who are struggling with making that daily decision to take the Suboxone, the buprenorphine, under the tongue, although there's also Bunavail and Zubsolv and Subutex, and there's other brand names. I'll try to stick with buprenorphine. So for sublingual buprenorphine, you have to make that daily decision that you're going to stay on track, take it. And for people who have a difficult time with that, the Sublocade, the once a month buprenorphine injection, seems to be actually pretty effective. So I actually thought that it wasn't going to work that well, that people who were given the Sublocade shot would just use more benzodiazepines like Xanax or alcohol or meth or something, and would just move to a different substance to get that emotional escape. But actually, for the majority of patients, it's been remarkably effective, and they're able to maintain sobriety, abstinence from opioids and other chemicals, and their use of alcohol and meth and those sorts of things actually declined for the majority of patients. Now, not everybody has done well with the Sublocade injection, but it's pretty effective. And so for a lot of people, it seems like the choice for them, was either to continue to struggle and relapse or go to a residential treatment program or to try the buprenorphine injection. And for a lot of people, because they have jobs or they have kids or they have whatever, going off to a residential treatment program just wasn't really ideal or feasible for them. Other people need to go to a residential treatment program and need to be kind of temporarily removed from their current circumstance, away from the stressors, the enablers, the whatever it is that's kind of trapping them in their current state of uncontrolled chemical dependency, and spend 30 days or 6 months or 2 years or whatever at a residential treatment program and then come back. Ideally, honestly, they would come back and continue either on the sublingual buprenorphine or on Sublocade. But back to the Sublocade shot, one of the things that got me really excited about it was a comparison study that they did in order to get the initial FDA approval, where they took a bunch of people who were taking sublingual buprenorphine, like 16, I think, milligrams a day, or maybe 24. But anyway, they were taking 2 or 3 Suboxones a day, and they gave them a shot of Dilaudid, of hydromorphone, and then they asked them, well, how does that feel? Do you have any euphoric effect or feeling from that? And they scored it out, and people still had some effect from I think it was 12 or 16 milligrams, I forget, but a sizable dose of hydromorphone. And then they started them on the Sublocade, the buprenorphine shot, and then again gave them the hydromorphone injection and asked them, did they have any effect? They called it the drug liking score. And after the buprenorphine shot, people really had very little effects from the hydromorphone. So it seems to more effectively block people from any effect from other opioids. And then again, it takes away that daily decision. Typically, you start with, if you've been on the buprenorphine sublingual for at least 7 days, you start with a 300 milligram injection right around the belly button here. And then once a month, you get another one. The second one is 300 milligrams again, and then you drop down to 100 milligrams, and you continue that out for, up to 12 months. And boy, it's been really good. People have gotten their lives back together and patched up their relationships and their finances, gotten their legal problems under control, that kind of stuff. So, overall, it's been pretty good. So good that I said, wow, we should really start doing this before people get released from jail or get released from residential treatment programs. And that's why I've started to, once a week, go to KCCC, Kauai County Correctional Center, KCCC, and start to see if we can get people started on buprenorphine or started on Vivitrol or Sublocade or whatever before they're released from jail, so that they don't relapse and overdose or relapse and get rearrested or what have you. So, I don't have that many patients on the Sublocade shot. There's maybe 170 people in my program right now that are taking buprenorphine for chemical dependency. I've got a whole bunch of other people who take buprenorphine for chronic pain. But for the people who take it for chemical dependency, we're talking, it depends, people coming in and out of the program, so anywhere from like 160 to 170 patients at a time. And, usually I have like maybe 7 or 8 at a time on the Sublocade shot. And I've had a few of them, we're approaching a year now of continuous therapy. And it's been pretty good. So it's an option if yourself or someone you care about is struggling with opioid dependence, is having a difficult time with the sublingual buprenorphine, just making that daily decision to continue with the treatment, and is having problems with relapses and that kind of stuff. The Sublocade once a month injection, although it's not right for everybody, certainly some people don't do well, don't follow up, or have problems with it. They find it uncomfortable, the injection initially. Although after a few minutes, usually the injection site discomfort goes away, so it's not like all month long. But the people definitely have not continued on the injection. I think mostly because they're just not ready to make that commitment to recovery, as opposed to problems with the medication. But hopefully they eventually get their head in the right spot and get committed to a change. And buprenorphine, for a lot of people, whether it's the sublingual or the injection or the patch or the implant or whatever, can apparently, from what people say, can help them stay in recovery, make progress, gradually taper off, and get on with their life. So that's my topic for the day, and hope that was informative. Thanks.